Greetings to all of you. Welcome to Head to Toe with Dr. T. Thank you for joining us this evening. Kumpomakapa TV, siyabulela banani. Sithetha ngezifo usukela enhloko elizwaneni because promoter impilo. More on prevention than curative medicine because that is the approach of South Africa and that is the approach of the World Health Organization. Today I'm so excited because I've got a very, very big high profile person to talk about the subject matter. Human papillomavirus and cancer of the cervix. Prof, thank you so much. Let me just let people know who you are. You qualified and did MPCHB. For a small child who's actually watching this program who would like to be you, just take us through your journey in a minute.
Okay, I matriculated at Bethel and then I went to UWC to do a BSc there. I majored in physiology and microbiology. From there, I moved in Ndabeka, Medical University of Southern Africa. I met with Sangoka, I think this is Fakongoko.
Yes.
Then I did an MBCHB corner. Kabakwam Dabuya and as a Livingston, as an intern, as a medical officer. Dayaga private, but I was called by women health issues and Manus Bona in my private practice. And some of the challenges that I experienced as well. Then I went back to the University of Pretoria to specialize as a gynecologist. There's a FCOG, there's a MMed. Ngexesha ndisela apha ndabhala diploma with the college.
Okay.
Then by the time this year there's a fellowship, there's a master's in medicine. Ndabuya ndazosebenza apha as a gynecologist.
Thank you for coming back to the province actually. With so much credentials. Professor Mabengo waphinde wabuyela ephondweni.
Ndaphinda ndatsend lapha ephondweni ndabuyela back ePretoria ndokwenza i-subspeciality abanye bathi i-super speciality ye-gyne-oncology. There's a certificate se-gyne-oncology as a super specialist with the college. Ndaphinda ndenza i-masters philosophy ze-gyne-oncology kwapha ePretoria. Ndaphinda ndabuyela apha ephondweni because ndandithunyelwe liPhondo. Then I did other things, masters in law, masters in management, and theology. That's where I am.
You've done everything on that actually. Thank you very much for the wonderful work that you do. You've produced so many specialists.
Yes.
Thank you very much for the wonderful work that you're doing, not only for South Africa, but for the province as well.
Thanks.
But we are here on your you are the first gyne-oncologist in the province. But today we're talking about human papillomavirus and cancer. For someone who doesn't know, what is the association between the two things?
Okay. Human papillomavirus, it's a virus that is very common. It's a common virus that is associated with sexual activity. At some point, all of us will be affected by this virus. Everybody with sexual active opela ebanayo. But the nicest thing about this virus is that the body is able to eliminate it within 2 years, especially if you've got good immunity and other things. Then it clears
without any form of treatment?
Without any form of treatment, because there's no treatment for it. That's why we must screen for it.
Thank you for explaining that.
So that's what happens. And then human papillomavirus can be actually as clearisha within 2 years. In types as Nizokanye, there are over 200 types of HPVs. Yeah. And these HPVs are, some are low grade, some are high grade types. Low grade types is insumpa or zenza kutwa genital warts.
Yes.
Then the high risk types, usually 16 and 18, zithi xa zikhona zihlala ixesha singazi-attend ziphele sezicancer. Yeah.
16 or 18.
16 or 18. Usually HPV is transmitted by skin to skin. Vaginal sex, oral sex, anal sex, those are the things. And skin to skin contact, genital areas, then those are the risk factors as indoba sekwazi uyifumana. But as Chilo, the body clears it. But if it persists, then iba a problem. The other problem with HPV, it is asymptomatic. Ivela ithi say senza cancer okanye say senza genital warts, so we must screen for it. It's an infection that may be asymptomatic until kute kuvela into. So it's very important to screen for it. uscreena ke kukukhangela into ongayaziyo nabikhona okanye ayikho na. Hence now we are advising ukuthi if you are more than 25
Yeah.
and you are sexually active, get screened for HPV. If you are HIV negative, you get screened at any time apho ubonwe khona. Umzekelo, if you are diagnosed as HIV positive, ngelo xesha udiagnoswe ngalo, we must be able to screen you because HPV, once ube ne-HIV, the risk of an HPV is almost 6 times the cancer. So you must always look for that collaboration between HPV and HIV. The moment you get HIV, get screened for you.
Say someone who has got it, you say there's no cure, but we hope that it will clear on its own. In case it doesn't clear and it's a virulent strain, then it's likely to cause cancer.
Yes.
How do we pick up cancer? And what do you do? Now we're going towards your...
Yes.
You spend a lot of time on this area.
Maybe let me start by saying, before going down, it's very important to vaccinate abantwana bethu.
Awesome.
Prevention is better than cure. So all girls currently, there's a campaign between 9 and 15, they must be vaccinated.
Thank you.
So as to reduce their risk into bafumane le virus later. Now, if unayo, you get an infection, how do you find it? You must go for screening. There's HPV DNA screening. Once we screen you and we see ukuthi khona and siyibone, we treat it. If it becomes persistent, we will treat it kwakhona. Mhlambe the high risk type is persistent, sokubiza kwakhona senze la nto kuthiwa i-LETS because the infection is right at the mouth of the womb.
Prof, let's just take a short break, then we'll be back.
Okay.
Uzocacisa i-LETS intona because abantu bayathanda ukuyo but hayi sawutshiswa awuzawunxelwa awuzawuthini, all these street languages and so on.
Okay.
You are doing this every day and you are training people on it. Let the community know what this thing is. We'll be back shortly. Thank you for watching us. We're talking HPV and cancer of the cervix. Welcome back to Head to Toe with Dr. T. Thank you so much. We're talking HPV and cervical cancer through the Fundi, Professor Mabenge, who is the head of ONG at Dorangenza Regional Hospital. You are also present at NMU and WSU.
Yes.
Thank you so much. You're all over. You are doing a lot for the country. People are so scared of pap smears. There's a lot of myths and stereotypes that are going around. Can you just, before you go to LETS, just narrate what happens when someone is doing a pap smear?
Okay, thank you. Pap smear is not painful at all. If you do a pap smear, you come in, we talk to you. Usually, a pap smear is to scrape the cells as per emlonyeni wesibeleko, the mouth of the womb, start a zona, and then says to lab. And that's a way of checking whether there is cells that can give you cancer or not. We just pass a speculum, and we look there, and we take a swab, a sample, and we're finished within a second. These days, there's also what we call self-sampling for DNA, which is like, it's even less than a tampon. A lady will take it and you push it in just 3 centimeters into the vagina. I roll in without anyone.
Sure.
I say a lab. Then a lab.
Are these things available in the public sector?
They
or
are
clinics
available.
or wherever?
They are available
We
in the
must
public
promote them.
sector.
In fact, I must get one. I'll
They are available. The province
Thank you
has
so
made
much.
them available. Now,
Prof, before you move, there's something that actually confuses people. When the pap smear, you've taken the pap smear, then
Yes.
it's gone to the lab. When it comes back, take us through the results and simplify
Yes.
it. This CIN thing and HSIL and whatever. Then people go, ndicela nindithandazise ukuthi ndine-cancer.
xa zibuyile results zisithi umzekelo buwenze i-pap smear.
Yes.
Sizabuya sithi either say CIN 1, 2 or 3. In other words, it's cervical intraepithelial neoplasia 1 or 2 or 3. That means extend the abnormality yala epithelium or eza cells is a pie. Now CIN 1 is a low seal.
Yeah.
So you don't really worry about that because 60% of patients with that CIN1, it will regress.
Awesome.
Now CIN2 no CIN3, bona, they are high seal. So once you have those two, then we refer you kwinto ekuthiwa colposcopy.
Awesome.
Colposcopy, sifaka a microscope and we look at the cervix if ikhona na into. And then if kunto sibonayo, the colposcope is adequate, then sends into ekuthiwa i-LETS. I-LETS licingwana nje elifakwa phaa kumachine, ususa nje eza cells eziphaa emlonyeni wesibeleko and then uzithumele lab. I-lab ibuye isithi hayi zisukile eza cells completely or not completely,
Okay.
or whatever. Then sikumanage according to that. If mhlambi ungumuntu othi hayi andisafuni bantwana ndigqibile ngabantwana
Okay.
and sezisusiwe cells sikwazi ukwenza i-hysterectomy. If usafuna abantwana sikwazi ukuthi hayi sakwenza i-cone ke kusika ipart yesibeleko yalamlomo ineza cells siyisuse kwenzela buhlale alright.
Okay.
Azikho buhlungu zonke izinto. Ukuba i-pap smear ibuya ingeyo CIN1, 2 and 3 which are pre-malignant.
Okay.
They are not cancer.
Okay.
CIN1,
Yeah,
2
that's very
and 3 are
important.
your cancer. It's either it's a low seal or high seal, but that's before cancer. If ibuya ke ngoku isithi hayi yi-cancer, then what we do thina siye sithethe nawe sithi unomhlaza une-cancer yomlomo wesibeleko. Then we stage you ke ngoku. When we stage you, we look at the bloods into yoba ayityhutyanga nale cancer ikangakanani. We look at imaging. We do chest x-ray, we do into ezifana ne-ultrasounds, we do CT scans.
Okay.
And then from there we decide ba are you operable or not? Can we operate you or can we give you chemoradiation therapy? Akatshiswa ke umuntu xa enziwa irradiation, ayitshisi ne-chemotherapy ayibulali. We must encourage our people ukuthi there's good
But how you
survival.
iron?
Hayi akho ne-iron, awusozibone ne-ironing board phaa. Iyafana nje zii-x-rays ezutreatwa ngazo. And the outcomes are as good as surgery, except into yoba xa uoperatiwe akuzofana naxa unikwe radiation in terms of healing nee-tissues njalo njalo, but the outcomes are more or less the same.
Prof, kuxa kutheni xa nisithi lo muntu akanaba sencedakala i-cancer? When do you reach that stage? We've got so many treatment modalities from what you are saying, and you have studied so much. There's so much intervention compared to the past.
Yes.
When do we give up and say, no, we can't do anything here?
Generally,
people
we
stand up.
we don't give up. We send you for chemo, radiation therapy. The only time probably we will not give up, but we'll give you palliative therapy is when there's recurrence or when you are in stage 4, and then we have tried almost every modality. Then CTA will give you palliation, but you can see nalapho into yoba it is the very, very last resort. There are lots of other things that we do before. Unfortunately, it will take us time to explain some of them because we'll send you to chemoradiation therapy,
Yeah.
ugqibe ube right, but we'll continue to monitor you.
Okay.
Sijonge into yoba le cancer ibuyile okanye ayibuyanga. If ibuyile, then we still have other options into yoba siphinde sikutreate up until you reach the last stage. Apho sithi khona we'll give you palliation.
Awesome. We're going to take a short break, Prof, and then we'll come and wrap it up. And while we are thinking about how we're going to wrap it up, we're going to look into complications of some of these things. The cancer, if it is left untreated or people come late, or complications of the kind of treatment that you're giving, and then how empty gynae wards are. You're going to give us a preview so that people know what they're supposed to do and so on as we go towards closure. Thank you for being with us. We're talking about human papillomavirus. 90% of people with cancer of the cervix, they've got human papillomavirus. Research is very clear there. So le gogo yoyamene kakhulu nomhlaza womlomo wesibeleko. That is why sifuna abantwana abakhawuleze bahlabe i-vaccine bengaqalisa ukwabelana ngesondo. Bonke abazali siyaba Kutaza will be with you shortly. Thank you for joining us again as we wrap it up with Professor Mabenge, who is a gynae oncologist, a specialist ke somhlaza wesibeleko. Yonke into esesibelekweni ene-cancer uyibona emanzini adilishane nayo uyincwadile straight. Prof, how empty are gynae wards in terms of cancer?
The gynae wards are full. They are full.
What are we doing wrong?
They are full. Currently, i-waiting list yam it's up until April
Yo.
ye-operation yabantu abane-cancer.
Mm.
What we're doing wrong is starts with screening. We must get screened. Akho nto inzima ekuscreeneni. As I was saying, we all have doctors. We all go to a doctor, either a clinic okanye kwagqirha okanye esibhedlele. Xa ukhona cela i-chance into yoba wenze u-pap smear. Number 2, masi ngoyika ukuya sokwenza i-pap smear. Even if we are on cycle kwi-menses, we must get a pap smear. Because it may be your only option and your only chance to get a pap smear. So we must always have pap smear. There's no reason why sinokuthi asikwazi ukwenza i-pap smear because usexesheni. It gets done all along. There was a study done by one of my colleagues, Union Herbs, with Professor Sneeman, that shows ukuthi bonke ababantu bebeboniwe by one of the health care workers bafika kuthi bene-cancer in advanced stages. So if we could...
Kodwa lo muntu ebenganqabanga kumaziko empilo.
Ebenganqabanga.
Meaning we are not doing what family medicine promotes, to use every opportunity for screening purposes.
We must screen.
But abantu bakhululisa unnecessarily.
No, we must screen.
Kuthiwa bendiyele i-tonsil. Ndawuphela sendisebhedini for a pap smear.
We must screen. If siyoyika, as Bansitsho, there is a self-sampling that we can also do.
Awesome.
But now, if there's something wrong with our uzawunyanzeleka uye kugqirha ikayini iphinde ukukhulisa. Unfortunately, ke ikayini ezininzi ngootata abamnyama abade. So that's the problem. Kodwa ke we must get screened.
Yes, Prof.
And number 2, I want us to understand as human beings, kunzima ukuthi uthetha about something that is in the private part. We need to destigmatize that.
Awesome.
To be able to talk freely with our doctor, if there's something that doesn't go well there. Now, ukuba ngaba so ne-cancer, we operate on the stage 1 with cancer. Stage 2, stage 3, usually say pumile say outside. Now we give you chemoradiation therapy. So the earlier you come, the better. The earlier we see this, the better. And I want to encourage omama, xa sinikwa consent zabantwana kuthiwa bazawunikwa i-HPV, let's sign them. Let's screen our children because let's vaccinate them as well. Ukuba ngaba owakho umntana umvaccinate azadibane nomnye umuntu one-HPV bese sishiyela binjani awumncedi laa mntana because uzawuba ne-problem into yoba asuleleke. Kanti ukuba ngaba ubumnikile i-vaccine, probably the chances would be less. I-WHO World Health Organization ithe we need to eliminate cervical cancer completely by 2030. We must have less than 4 per 100,000. We will not achieve that.
And we're currently around 26.
Yes, we're around there, 26.
That's a lot.
Ukuba ngaba besinosebenzisana, we can achieve things better. And I want to say, those who have a problem, sikhona, there's a gyne-oncology unit at Dora that we are running. As Bansitsho, the gyne wards are full. Abantu bayaza bakhale kube sekulate. Abanye funeka belinde ityhu because now we have to operate. Abanye sibabekelo April. Kanti ukuba le nto besiyenza kakuhle, siscreen sibonisane kakuhle size early, we would not have this problem. I've got 2 other gyne-oncologists that I've trained who are there for the state. We are all there to make sure that our women do not die of cancer.
That's awesome, Prof. Alternative medicine. A lot of people get diagnosed with pap smears and then they... How rife is that problem now? That people go after getting their pap smear results and they think, no, there's a certain person who is said to be treating cancer and so on, and then they come back later. What complications are we getting?
Okay. Mhlawumbe mandiqale ngokuthi alternative medicine, I think we've labeled it very badly for quite some time. We need to work with those people together because our patients have got trust. Kwezinto sikhule ngazo njalo njalo. So we need to encompass them and incorporate them because ukuba ngaba it's them and us. We're not going to win this. We need to work together. There are complications. The cancer is bakhona. Bleeding is one complication that is there, especially watery discharge. Ufumanisa into yoba umuntu uthe hamba nje une-watery discharge, unentloni nento yoba abe phakathi kwabantu. So PV bleeding, watery discharge, utyhutyha kwale cancer umzimba wonke ufumanisa into yoba it's going to the lungs, it's going to the bones, it's going to the bladder, it's going to the liver. So all these things are complications of cancer. And these are the patients abathi xa befika kube nzima kakhulu kubanyanga because the cancer is spread throughout the body. So the earlier, the better. ukuba uzayofuna i-alternative medication or traditional medication khawuqale ngapha kwenzela uba sisebenzisane asizothi sukuya kodwa sawuthetha nawe sizama ubonisana mhlawumbi notata lukwelaa cala okanye umama okuncedayo sikwazi uthetha naye sikwazi usebenzisana sikubone kahle so that we don't have women dying. That's our aim.
In terms of age, race, and so on, risk factors, can we just touch on risk factors and then as we close, just talk directly to the populations and all the communities to do something about the 90-70-90 strategy?
The strongest risk factor is human papillomavirus. If we could eliminate that, because it causes about 95% of cervical cancer is due to HPV. There are other associated factors like low socioeconomic factors, things like grand multiparity, things like early coitus. We need to talk nabantwana bethu bangaqalisi uindulge ku-sexual intercourse at an early age. If we had time, benza kucacisela why, because starting sex early risks your life to into yokuba cancer.
Okay.
So these are some of the things as COIO. But I just want to say to our population, kubabukeli bethu, masincedeni sithi hit to call WHO ka 90-70-90. That means 90% of children between the ages of 9 and 15 must receive a vaccine. Then 70% of women must be screened with a high screening test at the age of 35 and 45. 90% of women who've got cancer, they need to receive treatment. And we are there as gynecologists to offer this treatment. No woman should die of cancer in this day and age. And let us work together so that we are able to hit the call your WHO, so that we are able to eliminate cervical cancer completely. Currently, we are bad. We are 35 per 100,000. Globally, there are 13 per 100,000. And the WHO says, let us at least be four cervical cancer per 100,000. And I think we can achieve it as South Africans. We've worked together through apartheid, through many things. There is no reason. We've worked together with the HIV. We've worked together with COVID. And I believe that we can work together to eliminate cervical cancer.
We can eliminate cervical cancer. Professor Mabenge, let me thank you very much for honoring us at Mpuma Kapa TV. Thank you very much for the wonderful work that you are doing for South Africa and also global community. Whatever you're doing locally is quite impact, even huge impact, even internationally. Thank you so much. We will eliminate cancer. One of our first gynecologists in the Eastern Cape is talking to us to eliminate cancer of the cervix, human papillomavirus, cancer of the cervix, do screening, vaccination, screening, vaccination. Thank you so much. Prof, thank you so much. Message delivered. We shall work on it.
No, Diabulet.
So I spin. Thank you so much. I'll tell the picture now. Okay. I do PR. Prof, uyaphangela privately ngolesine ngomvulo nangolesine.
Afternoon, Monday 3 na Friday 3.
Yeah. Kudala abantu bakufuna actually.
Nanso into actually the tetanum yathi hayi khawuze banike I'm not paying.
Bakufuna njani?
Yeah, fully finished. Yathi mandiye only because of cancer, because there's no guide umguga use we trained umguga mos. And I trained to Chris. Umguga use McIntyre.
Okay.
So babona ke McIntyre unomntu kodwa cows. And Chris playing.
Oh, they're going to lose.
Yeah.
That's no balance.
We will work.